Hi YouTube, this is my first video. This is Dr. Penny, and I think today I'm going to talk about how to get along with nurses. Um, as I mentioned in my channel, I am a surgery resident, and I hope that I can talk about issues that are pertinent to being a resident in general, and hopefully focus on being a surgery resident, and give you some insights in case you are a resident or in case you are um, planning on going to surgery. So I'm probably going to come back to this topic at other times, and once I get a better camera, I'm hoping to actually use it. So anyways, so I'm going to talk about just getting along with nurses as a resident, and specifically as a surgery resident. Um, it is true that some nurses will treat you badly, even as a medical student. We all know that. When it comes to internship, I think that rings particularly true. Um, that most of the nurses are actually quite nice, quite easy to get along with, but there are those few that find it important for them to abuse the interns, and maybe that's um, the intern's interpretation, or maybe that is the nurse just being difficult. Um, I think one thing that residents can do in order to get along with the nurses is to actually listen. When they page you, you call back right away. Don't call back an hour. Don't call back in 30 minutes. Call back within seconds. If you do that, they will get the impression that you are listening to them and that you're responsive to their needs. The second thing you can do is, in addition to getting right back to them, is having some kind of action plan. So if they page you about, saying that the patient has pain, um, you know, give the patient either more pain medication, give them a script, tell them to get back to you in an hour, but have an action plan. Um, I think it's important to note that the nurses are the patient's advocate, and no matter how tired you are, no matter how upset you are, no matter how sleepy you are, it's just important to always keep that in mind, that the nurses are the patient's advocate. Um, Again, there are those nurses who will, be difficult regardless of what you do, and you just can't help it. You just have to work with them and move on and hope that it gets better. But most of the nurses are pretty genuine, and they're contacting you to um, help them take care of both your and their patient. Um, so those are the two tips I have. Call back right away, return pages within seconds if possible, and have an action plan for them. If you have other recommendations for how to get along with nurses as a resident, and specifically as a surgery resident, please leave a comment below. Um, I think that a lot of residents could benefit from um, your knowledge and your experiences. Thank you. This is Dr. Penny, and I will talk to you later. Bye.